If you enjoy this content, please take a moment to rate and review it. Your feedback will greatly impact our ability to reach more people. Thank you.
All right. Happy Thursday. How you doing?
I'm good. It's a lot going on in the world. It's good to get caught up in things.
Yeah. I don't even know where to start. I had a really bad night of sleep 2 nights ago, and then last night I got 9.5 hours of sleep.
Oh, nice.
Thanks to some blackout curtains in my room.
Yeah.
But I do have to say, it feels like there's a speed that things are starting to move at right now that is making it critical for this show. Because I don't know what I would do if I didn't have this checkpoint.
Yeah.
To stop and try to capture what has happened in these different categories and try to sit down with you and
what is real and what is hyperbole that politicians are saying for their own purposes, and there's a lot of both.
I mean, totally random, but I feel like I need to bring it up just because it's. So 2 days ago, this is going to be a hard left, and I'll circle back.
Okay.
So in the mixed martial arts space, there's a journalist. His name is Luke Thomas, and he used to be on Sirius XM, and then he left there and kind of did his own YouTube show with this other guy, and he's pretty well known as a really, really solid, thorough MMA journalist, like really detailed.
He understands the different styles and can break it down
at a deep level. Yeah. At a deep level. So, over the course of the last year and a half, I would say, and really heavily last year. Last year, you could really see it if you were an MMA fan and you were sort of watching his journalistic takes. One of the big things that happened over the course of last year was, Trump was ramping up his comeback, and one of the big platforms that he leveraged was the UFC. He's got a long-standing relationship with Dana White and the UFC, and the history is that, there were actually Republicans, John McCain, in particular, who was very much against.
It existing. Or
didn't think sport. Didn't think it should be a legal sport, should be outlawed, all this other kind of stuff. And at the time, Trump was more like Mr. Atlantic City. And so he was like, yes, he did a lot with WWE and so they was like, let's
he likes a good show.
Yeah, exactly. And he's into boxing and fighting and all that kind of stuff. So they started this relationship, and so now UFC is, one of the biggest. Yeah, it's certainly one of the fastest growing sports in the world. That's not a question. And they've got this global platform because they have fighters from all around the world. If you look at their champions, they'll be from Africa or from Eastern Europe or Spain or.
That's one of the great things about it is it's
a global sport.
Yeah, right.
Yeah, so last year, Trump was showing up at like every big event, and he would walk out in the beginning with Dana White and have the American flag sort of going on everywhere. And, and Joe Rogan is, this was all incredibly well coordinated, right? Yeah. All the way down to the Joe Rogan, Donald Trump interview at the end of the race. And then Joe Rogan endorsing Trump 2 days before the election or something like that. Like it was all just incredibly well orchestrated. So Luke Thomas, I guess, is a liberal, and he was getting like more and more like sort of riled up by the fact that this sports platform was clearly being used as a political campaign platform, right? And so more and more talking about that, and more MMA fans, because there's a lot of MMA fans that are on the right side of the aisle, kind of going after him. So anyway, I say all that to just set the stage for who this guy is. So he comes out with this post 2 days ago saying, hey, we're in a wacky world. I'm starting a Substack because MMA fighters are now, and MMA fighters and MMA owners now have an unbelievable amount of influence in politics, right? And nobody thought this would happen, but here we are. And so I need a different platform to like talk about this, because there's nobody who's actually qualified to talk about this level of influence, and it's very, very real. It's like it's way more real than people are giving it credit for, right? So Monday was St. Patrick's Day. Conor McGregor, you know Conor McGregor.
Yeah.
Conor McGregor, most well-known mixed martial artist of all time, was in the White House for St. Patrick's Day. And he was in the Oval Office, and he made a statement about all the issues in Ireland, and the things that need to happen there, and how it needs to be much more like the Trump administration, and how, you know, all the things around immigration, and you can pretty much put it together. So then today, he put a post out on Instagram, and he's running for president.
He's running for president of Ireland?
Of Ireland.
I guess that's good. I don't know if that's good or bad. I guess that's good.
I'm not asking you to respond to whether it's good or bad, right?
But it's incredible, the change.
And it's Conor McGregor. I mean,
he's probably going to win.
He's probably going to win.
Yeah.
He's probably going to win.
Yeah.
So, a long way of just talking about how rapidly our world is changing in ways that people just really had not previously considered.
Yeah.
It's something else. It's something else.
Yeah. I mean, the establishment, the institutions, the rules of society, how everything works after World War II, I think are going to be completely questioned. And many of them will be changed. And I mean, after Trump won the first time, I now am not surprised at the difference, who wins elections. It's a I don't know, it's an emergent property. The population does whatever they do, and they're not looking at like a detailed list of pros and cons. They're deciding the way they decide everything, partially rationally and partially maybe more than half from emotionally.
Yeah. So yeah, thank you for continuing to sit in with me every Thursday before we even get going, just because I would have a very hard time. And I'll tell you what else, man. I notice it when I talk to other people. I think people are so overwhelmed, not just with the whole flood the zone strategy, but I think the whiplash, the 180 plus the flood the zone, it absolutely will short circuit you. You know what I mean? It absolutely will short circuit you. And I think we're lucky both because we have this platform to think through all this stuff, but also we sort of saw this all unfold because we were early listeners to All In. Yeah. You know, we watched how those four guys started talking about VC and then, then COVID hit and then Sachs kind of took it in this direction and the different, and watching Elon sort of, come onto their platform and I feel like we got to see this unfold. And so we understand the players and why it is the way it is and why Scott Besson just did an hour-long interview with the All In guys. And you know what I mean? And I feel like even what I just shared with you about mixed martial arts is I feel fortunate that I'm a fighter. So, I mean, you've
either been in the ring or on the mat fighting or you haven't.
Yeah,
I mean,
that's right.
And it's not, there's no middle ground really. Yeah.
No. So anyway, and even with all that, this is still a lot to track.
Yeah. Yeah. And I think it is, the benefit for me is that people are very emotionally triggered by something that happens one way or the other. It doesn't matter which side you're on. And here in Nashville, we have plenty on both sides.
Sure.
And I think the fact that it's healthcare and we're going to have to talk about it and be reasonably balanced and try to get to what's actually happening and what's the messaging, and those aren't the exact same thing.
No.
I think it helps me be able to not just immediately react to some thing that happens on CNN or Fox or on the radio and have more, maybe not more grounding, more perspective or more ability to take a deep breath and try to like see, okay, what's real? I mean, there's plenty that's going on that's real.
Yeah.
But there's also a lot of noise.
There's a lot of benefit, and then we'll actually get to the show. But there's a lot of benefit to not being easily triggered, and I don't mean that in some stoic way. I mean that in a way where you're actually able to digest what's happening and put it onto some form of scaffolding that your brain can actually make sense of, right? Yeah. And so that's the thing. Even though things are happening at this incredibly rapid pace, I still can mostly make sense of it.
Yeah.
For the many millions of people who are unable to do that because they don't have the mental model, they weren't exposed, for all those reasons. This is just,
it's just scary and
trauma.
Traumatizing.
Yeah, it's trauma. All right. With that, let's dig in. The economy. The Fed met and they are holding still, but we have Polymarket saying we're likely to get a series of cuts this year. Tell me a little bit about that.
Yeah. So the Fed met and they kind of, as you said, they're still concerned about inflation, but they're also somewhat concerned about the job market and didn't make any changes, but they did reduce the QT pretty dramatically from, I think, 25 billion a month to 5 billion.
That's significant.
So that they're reducing their balance sheet at a much slower pace.
Yeah.
Which is not accommodating, but it's less friction. It's less money being removed out
of the system. Yeah.
So I think that was positive. And then, the poly market and the bond markets are suggesting there'll be 3 cuts this year. I don't really, there's enough layoffs and changes in the economy in addition to the tariffs. Mm-hmm. He spent Jerome Powell spent a long time in the press conference talking about tariffs are going to increase inflation. And so he's cautiously watching that. I don't believe that that's going to really happen, but we'll see.
You don't believe that tariffs are going to increase inflation?
I think they will, but I think the job cuts Doge is doing and other things are more of a drag on the economy. So I think net, it's going to be
Well, I was actually in a meeting today. I mean, both things can be true, but I think if we're just talking about tariffs in isolation, I was in a meeting today with a guy who runs a boat company. Okay. And he said over the last week, 90% of his suppliers came to him and said, everything's going to cost 20% more.
Yeah. I mean, I have that in my portfolio companies. We are going to have to raise prices because a decent amount of our medical device supplies come from China or come from somewhere where there's significant taxes. I think that's a fact.
Yeah, I mean, that standalone is for sure a fact.
Yeah.
Okay.
I also think that the economy is slowing due to federal job cuts. And so I think those things will net out, but we will see how fast either one of them take effect.
But will it net out in the CPI? I feel like that's the question.
Yeah.
For the consumer, does it net out?
I think we'll have to see. I think it will.
I get your
we'll
macro
see.
equation, but I'm like, I'm not sure those two things touch fast enough.
Yeah. The question is timing.
Yeah, it's a timing issue. Right. Okay. All right, next story. Consumer sentiment tanks as Americans expect more pain ahead. Look, consumers are right.
Yeah, that's right. And it fell dramatically. I mean, 11%, like month over month down. And I think it's just the volume of confusing, scary, negative, maybe we need this detox, but it's going to be painful. All that news coming out at once, I think, makes consumers' sentiment go down.
Yep.
It just does.
Yep. Yeah. I mean, there's nothing more to say other than like I think the Fed is accurately tracking what consumers are concerned about.
Yeah.
Yeah. All right. Retail sales edge up in February, but miss expectations. And I think they also redrew the numbers for January, right?
Yeah, that's right.
The
They
Commerce
revised January down. So, I mean, all of these stories are sort of intertwined, right? Like consumers are feeling worse. They don't buy as much at the mall or at a store or online.
Vic, we've been doing this show for 2 years. Have we ever had a happy economy section?
I don't think so. No. There's been times when the stock market went up.
Yes,
but
it's the only thing we've been able to point to.
Yes, but there hasn't been a good economy.
Yeah, the stock market has gone up and inflation has come down.
Yes.
And the third thing I will point to is GDP grew. So those three things all occurred over the time we've been doing the show. But for the consumer, like it doesn't feel like this has been a good economy.
Yeah, the
lots of layoffs.
Yeah.
The entire time we've been doing the show. Lots of layoffs.
Yeah, the GDP growth, I mean, I don't have the facts right now, but it was a lot of government spending.
Of course.
Which didn't necessarily flow that evenly to the overall economy.
No.
So like the GDP number was good for the quarter or for the month or whatever, but you didn't really get that like buoyant, everyone in downtown Nashville feels like we're all doing better.
That's right.
And unfortunately, I think that's the trend we're on.
The Trump team explored simplified plan for reciprocal tariffs. And so we're closing in now. April 2nd is our target date. And instead of picking particular fights with certain countries, it looks like we're simply going to assess whether there's a tariff on us. And if so, we're going to place the equivalent tariff on them.
Yeah, that's right. And I think it's taken since the election for Trump and his team to try to figure out how to implement this. But it's a simple and really easy to understand framework, which is why I think Trump likes it, which is we're going to have the same reciprocal tariff that they have on us. And so if a country like Mexico or Japan or China or any country you want to name has 10% tariff, then we're putting that on them. And if they want to reduce that to 5%, then we would encourage everyone to reduce it in a reciprocal way. The issue is that it's difficult to measure that. And some countries, including the U.S., try to protect particular industries. And then, of course, each country's GDP is of different size. And so are you weighting the total dollar amount or the percentage? It gets super complicated to try to implement. But but messaging is good. And they are planning to roll out something in some kind of tiered system that I think will be better than the haphazard thing they're doing now. So I'm hopeful there.
More about the growth of stock exchanges in the state of Texas. Nasdaq plans a second U.S. headquarters in Texas. And this terrible, terrible name for the growth of stock exchanges in Texas that needs to die, Y'all Street. It's awful.
I'm not going to use that.
Awful.
Yeah, so the Texas Stock Exchange has already started down there. Nasdaq is opening an office. We're going to have
and the Texas Stock Exchange is the New York Stock Exchange.
It's
moving their Chicago outfit to Texas.
Yeah, so we're going to have the NYSE and Nasdaq having New York and Dallas.
Yeah,
and I'm going to take that as positive. but it also is creating this, two different segments of the U.S. country that are now more self-reliant, which is maybe okay, but also...
Well, the economy appears to be legitimately bifurcating.
Yeah, but that's not... I don't know if that's good.
It's not good. It's not good.
Right.
But it appears to be like, the lightning rod for this is Tesla, right?
Mm-hmm.
Tesla is literally the reason why the stock exchanges are moving.
Yeah.
They're the ones driving all the outflow of companies from Delaware. And, people are vandalizing Teslas, setting them on fire, arson attacks. People who may be liberals and bought a Tesla in the beginning because it was, good for the environment. Now are worried, looking to sell their car, whatever. There's a real bifurcation of the economy happening.
Yeah. And I think I want to separate these two things. That the move from Delaware to Texas was related to Elon Musk's CEO pay policy, I think.
Mm-hmm.
And
you're being precise now, so I'm going to track what you're saying.
Yeah, so I think it should be allowed for a board to incentivize a CEO in assuming that the shareholders vote on it in whatever way they want.
We discussed this week.
Yeah, we discussed it. So
yes.
that I think was an unforced error by Delaware. I don't know why they did what they did.
Mm-hmm.
It doesn't make sense to me.
Well, it was probably political in nature.
Yeah, maybe. I don't know. Probably. And then you have the sort of Trump/Elon doing Doge. I think that has driven the vandalism and all of the problem fires and issues at Tesla now.
No question.
I don't think...
Well, that and also like X. If you're on X and you see like Elon is so incredibly derogatory to the left and Democrats. It's there. He can't possibly care about Democrats being customers of his the way he talks about them. It's just
Yeah, and I don't think anyone should buy a product that they don't
of course not
like the product or like the person running it.
That's the free market.
But I don't think I think we need to try to draw a line at violence and setting fires and shooting stuff.
Completely agree. So, but circle back to your point. Your point was around the difference.
These are two different things. So
yeah.
I think the Delaware not upholding the incentive pay started this whole move to Texas, and it is probably now got a life of its own. But that is different than Elon's political endeavors, I think. But maybe they're all tied together.
I think they're pretty closely related. Because here's the thing: even if you impact Elon's companies directly, I think the thing you can't impact is how incredibly influential he is to the business leaders who are aligned with him and what he currently stands for. He's, the Mark Andreessens of the world, or he is held in the highest regard by so, and I think this is probably one of the things we're diverging a little bit here, but I think this is actually one of the really weak points of the left when they talk about Elon. They say things that are just like categorically like untrue, like he's not very smart, or you know what I mean? Like they say these things and you just can't be taken seriously making those kind of comments. You know what I mean? Like,
yeah.
Have you seen a SpaceX launch and landing before? You know what I mean? Like, so if you want to stick to the fact that he's derogatory, his involvement in the last in the election, particularly in the state of Pennsylvania, is questionable, like if you want to sort of focus on actual things, I think that's far more effective. I don't think the violence. Let's not say violence. Let's just talk about like destruction of property and vandalism, and because I'm just not sure of anyone being hurt yet. So but that stuff that's not helpful. You know what I mean? That doesn't advance anything. But no, I mean, Elon is a massively influential person, and I charge him as being, and I don't say this negatively. I charge him as being sort of the key influencer driving these stock markets, to move into the state of Texas. I think he's the fulcrum, of that movement. So. All right, moving into VC, Inspiren banks $35 million to scale AI-powered senior living technology.
Yeah, so this is really interesting. Senior living, it's a really hard business. You have a lot of seniors, and then you have their families, and they need support. They don't have that much revenue flowing through for all the work they have to do.
Yep.
And so this is a sort of a all-inclusive AI kind of operating system that works with with each senior, but also helps run the overall senior living facility. It's a great idea. Whether they can get adoption with this user base, I don't know, but it could be great.
This user base needs new technologies, no question about that.
Yeah.
Third Prime, local venture firm, is in the deal. Avenir is the lead on it. So some good firms behind this one.
Yeah.
Best of luck to them. I have no idea how to pronounce this. Proscia?
Yeah,
let's just try that.
So. Yeah.
Proscia pulls in $50 million for digital pathology.
Yeah. So, digital pathology is basically looking at cells and lab, blood work. It's hard to digitize.
Mm-hmm.
And so they have been working on it for a long time. This is another round, and I hope it is successful. It's a difficult transition from. I mean, if you take a MRI or an image, it's already digital. The slide work is wet lab work, really, and so digitizing that to a format that can be then useful has been the real bottleneck. But it'd be great if we can get it there.
Okay. So looking at who's around the table here. Alpha Intelligence Capital's U.S. Fund, Triangle Peak Partners, Avenue Capital Group, not names I'm terribly familiar with. The CEO basically positioned this as saying this round helps us to get to a public scale company, and so I think they're looking to IPO after this round. So for runway purposes. So I think your point stands, which is the technology here is very, very difficult. Medalogix.
Yeah.
So our old buddy Dan Hogan and Forcura merged to form a $1 billion healthcare software business. So Dan was the founder of Medalogix, wasn't he?
Yeah.
And then Crusoe's company,
Medicis.
Medicis bought a control.
I don't know if they had control, but they significant stake.
Stake.
Dan, I think Dan left.
Yeah. Dan's doing more fun things.
Yeah, right.
Now. Working with Clint Smith. But Medalogix and Forcura merged. They form a $1 billion healthcare software business, and Berkshire Partners is leading the combination.
Yeah, so I think it's great to see it sort of grow into this and, have a more independent future. After Medicis, sold to United, I feel like Medalogix was just kind of like lost in there. So, it's great to give it its chance to have a whole life.
Sure. All right. This is Israeli startup just inked the largest cybersecurity deal ever. So this is the Google Wiz deal that last summer fell apart, and now it's on. So it's a $32 billion deal. Wow, that's a massive deal in the cybersecurity space. So not really, healthcare, but I think it's important because the deal fell apart last year, and it wasn't clear whether or not it was because Wiz wanted to go it alone. They thought that dollar amount wasn't sufficient, et cetera. But here they are finally getting the deal done.
Yeah, and it's not healthcare, but we have a lot of cyber issues in healthcare.
Absolutely.
And then it's going to be we'll talk about another FTC thing in a minute, but it's the first big FTC question for the Trump FTC and Justice Department. Are they going to allow this or not? Google does not dominate cloud. And so adding a cyber cloud security platform when they're probably the third biggest.
They're third behind Microsoft and Amazon.
It should be, I would think it'd be okay, but we'll see. It's a $30 billion acquisition, so certainly it'll be looked at, and it will help us better understand
the position.
Let me say, if they fight it and try to stop it, that will send a message different than if it just goes through.
That's right. And the FTC is starting to get active, as we're going to discuss here in a little bit. GSR Ventures spins out new branch, Informed Ventures with tenured partners. So this is a net new VC firm investing in digital health startups and software as a service consumer products. So $200 million fund. They've got physicians, entrepreneurs, engineers on board. And we've got a net new healthcare venture fund in America.
Yeah, and I think it's positive to have a new money coming in always, and then they do have a lot of actual healthcare experienced folks around the venture that are physicians or policy, and so I think they have the right set of experiences. Which is good.
All right, a couple of analysts posts here from HFMA. So the first one from Nick Hutt is doing a roundup on Dr. Oz and how he describes changes he would bring to Medicare, Medicaid, and CMS as the administrator.
Yeah, and I think he's been pretty transparent about how he's thinking about it. But basically, it's focusing on the recipients and trying to help the Medicare and Medicaid recipients at the end of the day get better care. And I think that's his North Star. Now, he's going to make lots of decisions along the process, but that's probably good.
Yeah. Okay. So, I mean, I don't know how different that would be from what other administrators in the past would say. That seems like the charge of
maybe
of the agency. So maybe let's dig in a little bit more. So one of the things that the article focuses on is this idea of better tools and more transparency. I mean, look, Medicare and Medicaid are dealing with challenging populations, I would say, particularly with technology. The ability to reach those populations and for them to be able to understand what you're trying to, communicate with them, just because they may not be effectively resourced or as digitally literate. These are hard things, like if I'm just taking my parents, for example, I mean, I am the digital front door for them, right? Everything kind of runs through me and then gets to them. So maybe better tools helps the responsible child of many Medicare recipients. In the case of Medicaid, I remember back when we were working with Hugh Hale, at TennCare, one of the big challenges was reaching people, Medicaid recipients, right? Just even reaching them was of significant difficulty. Forget better tools and transparency. I mean, that's assuming you can even reach them in the first place. So anyway,
I think that there's no question about that. I think that some of this thrust towards transparency is getting the hospital and insurance company prices more out in the open and transparent. Not necessarily because your dad will look at it, but because a venture capitalist like me might see a market where I should go open a new thing because it's very lucrative in that market.
Yeah. Medicare Advantage. So I think everyone was kind of edge of their seat waiting to see where he was leaning here. And it sounds like he feels that there is a lot of upcoding and it's happening systematically. And that there's work to do to sort of clean up some of the practices inside of MA today. So this may mean MA is going to be a less profitable, line of business for payers in particular.
Yeah, that's right. I think it's going to be a challenge to even figure out where upcoding is going on and stop it, because there are. I mean, you can more accurately diagnose someone and get them to a higher risk pool and not necessarily violate the law. through attention and calling people and asking them what their symptoms are.
Yeah.
I don't think that's illegal, but that is what many M&A plans have done sort of systematically to increase their billables.
Yep. Prior auth, I mean, I think everyone agrees this is an area of significant opportunity to streamline this. It leads to a lot of dissatisfaction for patients and it's, and providers. So I think providers get really frustrated with the prior auth process as well. So that seems like a simple one. And then on the topic of Medicaid, it seems like the focus here is on the enrollment itself. So less about particular programs, which I think a lot of people were worried about, and more about, hey, who's actually enrolled in Medicaid and should they be enrolled in Medicaid? So, and I guess his position here is, if you've got people who are enrolled in Medicaid who shouldn't be, you're actually taking, away from the people who absolutely need it and who the programs were designed for.
Yeah, I think that's right. And that's certainly what he said. I do think there's going to be some attention at supplemental payments, but he didn't talk about that.
Yeah. And then the final point here is rural healthcare. So he's in favor of telehealth for rural healthcare. Thank God. Yes. That seems very
obvious, but no one has said that before.
But no one has actually just come out and just said those words. So I thought that was really nice to see. He was just, unafraid to make it very clear where he stood on that. And then the second post here from Nick at HFMA is around the Trump administration charting a new course at the Center for Medicare Medicaid Innovation, so CMMI, and basically shutting down 4 alternative payment models. The Maryland Total Cost of Care, Primary Care First, ESRD treatment choices, and Making Care Primary. So all these models will end by the end of the year.
Yeah, and I think they have not been successful at reducing cost and improving outcomes. And so I liked the concept that Stephen and I would try new things and innovate and test models and push towards value-based care. And also, I think they have collected a bunch of data saying it didn't actually have the results they wanted.
All right. This story from Wall Street Journal Pro, Venture Capital. Startups prep for potential Medicaid cuts. So I'm glad you included this because I've been asked, several times by investors, by LPs in particular, hey, what are your thoughts about the potential Medicaid cuts? I mean, they're likely to come. How does this impact your fund, right? And my answer has been, I think, a lot of what this article says, and this is basically talking to different VCs. So that, and the point that the VCs are making here is that cuts should drive more appetite for efficiency and innovation. Right. If that actually is going to play out, I guess I've finally been in healthcare long enough to where I'm a little cynical about these kinds of pressures actually driving adoption for innovation. I feel like I've seen multiple things that should have resulted in that and have not resulted in that. But I think the idea here should be we're going to have the same number of people and we're going to have less money. And so we need better ways of caring for these people. And venture-backed startups should be one of the ways that we sort of address that, that gap.
Yeah. So, yeah, I think that's right. The finding ways to deliver care more effectively, less expensively, I think is going to be an opportunity, no matter what happens with regulations. As I said in the last story, I think supplemental payments might go through a lot of changes. So if you rely on that for your business model, I think that would make me cautious. But the last investment I made was in a pediatric physical therapy, occupational therapy company, and they're 100% Medicaid. Mm-hmm. But they're using telehealth to increase the number of available visits by a little over 200%, in a place where about 30 states have shortages. So I think we're gonna need to find ways to do stuff like that where we can help the patients in a way that's cost effective. Yep,
agree. Trump fires 2 Democratic FTC commissioners, and the new chair, Andrew Ferguson, defends the decision. So the FTC, I think, is an agency that is of great interest to Trump. obviously trade. And this is, where to even start here? Trump is sort of showing us where things were conventions and not laws.
Right.
This whole 3-2 thing, we talked about this so much during the Biden administration, right?
Yes.
Three Democrats and 2 Republicans. And, we would often talk about this in the context of the SEC and the FTC, those 2 agencies in particular, right? Because the minority is there expressly for the purpose of dissenting and at least presenting the other party's view on the topic, right? And that's helpful for the American public, even if the party that is in the White House is going to have the advantage and pretty much 100% of the time win the votes, right? Having the dissenting voice be present is valuable, right? So you don't need to have all 5.
Right.
To get your agenda done.
I would say it actually is going to impair the FTC's ability to get their agenda done. Because when they go to court, I don't know if they're going to block it or not, but say they decide they want to block Google's attempt to buy this company Wiz. It doesn't matter if they do or not. They're going to try to block something. They'd have much less credibility going to the court because there certainly is less opportunity for a healthy, diverse debate internally that would give them a credible position for the court. So I think it actually makes it less likely that they would get their things approved, because usually the company would fight it. But the last FTC didn't have great success in court. So, I mean, I don't know. Maybe I think Trump is showing that there are a lot of things that are matter of convention, and he doesn't care about that. No. He's just running over that.
No, not one bit. And I guess I just look at this and I don't understand it. It's going to be challenged in the courts and all the things, right? But
I don't know why he wants it. It doesn't make sense to me.
It's not clear to me either. It's not clear to me either. Like, unless you want absolutely no dissent. And that's, that gets into a whole other conversation that is very uncomfortable.
And it's not good on a lot of fronts.
So
that might be, in fact, the reason, but that's still not good.
We'll leave that there. But but why else would you need it? You don't need to have all the commissioners in your party in order to. You don't need that.
Right, and I think actually in some cases it's not going to be helpful.
Yeah. Another story here on the FTC. They pushed back again on an Indiana hospital merger. This is the second attempt. And I think this is important because Lena Khan's FTC was very, very, very aggressive in working with state AGs and blocking these kinds of mergers. And here we are under Trump's FTC.
Yeah.
And they are continuing with that. So this is a nonprofit that has been owned by HCA, and now they're looking to, merge it in with another nonprofit.
Well, hold on. The HCA's facility is for profit, I think.
Yeah, but when HCA bought it, it was nonprofit.
Oh, okay, yeah. When they bought it, was not. Yeah, right.
Yeah. So it was a nonprofit. Yeah. HCA bought it, and it was part of one of these like crazy COPA deals.
Yes, right.
These
public now they're trying to sell it.
And now HCA is trying to sell it. And you would think, okay, selling it off, getting it back into the nonprofit, it's more community based, like that would be good. But there is a general view by many conservatives that hospital mergers are bad for the public and that they stifle competition. Now, if you're the FTC, I'm not sure how closely you're actually tracking this deal of a 341-bed hospital. You know what I mean? But But look, I mean, I think at the same time, if you're simply trying to start to lay out your view on these things, this would be the first deal for you to bring up. You know, and HCA, it was during the Biden administration, weren't they looking at acquiring a hospital in Utah? And then, you know, kind of the FTC put laser eyes on it, and then they just kind of backed away and they said, okay, forget about it. Yeah. We're just gonna focus on operating. You know, this might have been them saying, okay, we're in a new administration. Let's see. And it looks like they're starting to kind of see what this looks like.
Yeah, I mean, I guess I'm of two minds. In Terre Haute, Indiana, which I've never been there, so I don't really know.
Yep.
But I don't know if we need two hospitals, one 340 and one 298 beds.
Yeah, so
I'm not sure you need that much.
Yeah, so that's the viability mind.
That's the viability. Like, is it possible to keep these two functioning?
Right.
But I do agree with the FTC that it reduces competition. There's no question it reduces competition. If you are a doctor or a nurse or anyone interacting with those health systems, you now would have only one employer to negotiate with, or you'd have to move some miles away. But if it's not viable to have two facilities of that size, that doesn't really matter. I mean, it's not viable. You don't need competition in tiny markets that can't support the competitive landscape. So I don't know. I don't understand their framing, but they projected it.
RFK Jr.'s Health and Human Services picks up Biden administration's legal fight against 340B rebates. So this is RFK now, you know, starting to establish his position, and he is taking the side of the hospitals and not taking the side of the pharmaceutical companies. That's not surprising at all. But I guess the hospitals need a win.
Yeah, and it's good to have some good news for the health systems.
Yeah,
I think 340B needs to be, let's say, updated and evolved. We'll have a story later that some startups are working on it. I think the pharmaceutical industry suing everyone and trying to just like blow it up maybe isn't the best way to go. So I'm happy that Kennedy is fighting back, and it's going to be a long process.
I mean, 340 is just a trap, right? I mean, it just shows you how complicated the healthcare industry is. You create something for the purpose of trying to benefit, you know, poorer populations.
Yeah.
And it's a mechanism that seems pretty straightforward and should just work. And it's like
it can get contorted to do lots of other things.
Yeah, it gets contorted to do a lot of other things. And then, you know, the way that our industry works, it's like certain factions are mad about it because they're not getting the, you know, this was not the intent of this program.
Right.
You know, if you're going to be selling it to people who they shouldn't get it, you can't use it to bolster your P&L. And, you know, it's just.
Yeah, you have, you know, I don't know, a wealthy pharmaceutical company, I'm not going to name which one, fighting against a wealthy-ish pharmacy company. And that's not talking about the actual people that we were trying to help.
No. So it's just, you know, we'll let them work it out. The Trump administration is weighing major cuts to funding for domestic, not international. This is not Africa. Like, you know, this is not, you know, all the Doge USAID stuff, right? Yeah. For domestic HIV prevention. So, look, we talked about this before we hit record. When you are trying to cut the deficit in the way that this administration is trying to cut the deficit, almost everything is going to be on the table. And you're going to start hearing some, you know, some headlines that kind of turn your stomach when you think about the idea that we're going to cut funding for those things. You know, for me, knowing the, you know, the populations that still struggle with the HIV virus, you know, this is not happy. You know, there's a picture in this article of you know, people with brown skin, right?
Yeah.
I mean, you know, so this is and it's at the Harlem Pride Parade, right? So this is, it feels like it can be targeting certain populations, and when you look at the numbers, I think it's good. It's just one of those things that's going to get people, very, very emotionally riled up, and we have to find ways to not be so triggered, because there's going to be a lot more of this, So I don't say this from the perspective of like, hey, if you're opposed to this, don't fight. I say this from the perspective of, this is one of so many headlines like this. It's going to be so hard for people to, deal with, and they're not going to stop coming. That's for sure.
Yeah. Well, I agree with that. I mean, I think that we are changing the way we review these things now. For the last 50 years, it's been, if we can do it, we should, I think.
Yeah.
Like, if we can prevent HIV, we should.
That's
period,
right.
Full stop.
That's right.
And now we are saying we can no longer print unlimited money, and we need to weigh the cost and benefit. And that's a hard transition. I agree that we have to make that transition, but it's a hard process.
Well, the reason why it's a hard transition is because the previous stated position refused to acknowledge our balance sheet as a country. It just wouldn't even talk about it.
Yeah.
It would just say, no, we'll
be fine.
We should do this. We should do this.
Right.
Like, we're finally having a real conversation, not a theoretical, not a think tank, not an academic, not a, wow, look at that debt clock. Isn't that a shame? Yeah. Like, we're finally having a real conversation about the balance sheet. And it's like sins of the father, honestly, it reframes all of the past decisions in this new light, where we have to realize all of those really amazing, great things we did so without much fiscal responsibility in mind at all.
Yeah. And we're going to make lots of mistakes on like what to cut and where to go, but getting to this point where we're actually having real discussions, and we're going to cut somewhere.
That's right.
Okay, so we got to cut $1 trillion. We spend $20 trillion, so 5% has to be cut. What are we going to cut? That, I think, has never been done in DC. Maybe there's been a year or two where this has been done, and so it's going to be hard. People are going to be upset, and
it's going to be hard.
There's going to be some benefits that are taken away.
Yeah. It's going to be rough. I don't like this headline. I'm sort of outing myself.
Yeah,
this is not a good headline for me to read.
I mean, no one in America should die of HIV.
No.
And it does take a lot of effort and money to get to the populations at risk who do not read the Wall Street Journal. And so I understand that. You have to get to the, whatever it was called, the Gay Pride Parade, that's probably not the right name of it, and be out there at the parade teaching people, and that costs money.
Yep.
And at the same time, I think we need to figure out how to cut 5%.
Yeah. All right, Cigna finally closes their $3.3 billion sale of their Medicare plan to HCSC. So congratulations to Cigna. This is, I think, a great deal for them. They are now a much cleaner story for Wall Street, a very clear, pure play commercial insurer with a growing payvider business in their Evernorth unit. And they don't have this Medicare Advantage albatross around their neck anymore. So good for them. Yeah.
Yeah, they've been trying to get themselves to this position. I think it's good. I agree with you.
Yep. Employers get big drug discounts through a program for hospitals that serves poor patients. So this is back to the 340B. This is an innovation story. We've got sort of a fleet of net new companies that are coming out, partnering with employers, looking over their employee base and basically saying, hey, you have a bunch of these employees where you should not be paying these kinds of pharmaceutical rates that you're paying. and let's just route them to a better place, a better pharmacy, which is going to be the 340B pharmacies.
Right.
And that is good for the employers, lower cost. It's good for the employees, again, lower cost. Good for the 340B hospitals because more volume.
Yeah, so the pharmacy that they're choosing is the hospital's pharmacy.
Yeah, exactly.
Yeah.
So that's good.
Right.
Because that's more volume.
Yeah.
Right. And they get fees. I mean, they're not getting the spread.
They're not getting as much lucrative 340B as they would otherwise, but they get the patient population coming in. Right.
So that's good. Bad for standalone pharmacies.
Yes.
Bad for Walgreens. CVS.
Yeah. And it is much closer to the original intent. It's not exactly the intent, but it's much closer. And so this is what I was thinking about when I said that the market might do a better job than people fighting in court over how it works. But maybe we need both ends.
Highmark posts $29.4 billion in 2024 revenue amid ongoing rise in utilization. So here are the key numbers here for Highmark Health. $29.4 billion in revenue, $50 million in net income, but $209 million in operating losses. So, what's the beauty of a very, very large balance sheet insurance company? You might have a bad year from an operations perspective because your utilization is really high and you can't keep your medical rates down. But you got a balance sheet, you're investing. S&P was up 20%.
Yeah, you
plus
made $250 million in your asset base.
Exactly. So you're up $50 million at the end of the day. So it's nice to have that balance sheet. That's for sure.
Yeah. Highmark's a good, well-run payer. I think it's good to follow them. It's hard. I mean, it's hard to operate as a payer now. So they're not as big scale as the nationwide players, but they're pretty big scale and concentrated.
$29.5 billion. That's decent.
Yeah,
that's decent size,
and it's tight. Right?
Yeah.
So it's what struck me is just how I think they run a pretty good operation. I don't know a lot of people there, but they seem to.
That's not a lot of net income on almost $30 billion.
Right. That's what I was going to.
Yeah,
right, exactly. So I think the insurer payer side, almost no matter where you are,
it's a hard business.
It's a hard business. Getting hard. Yeah.
Yeah. Mass General Brigham announces a $400 million cancer care investment ahead of the Dana-Farber split. So we've been covering Mass General here for the past, couple of months, and the stories have been bad, layoffs, operational misses. One thing we know about health systems, cancer care generates a lot of money, a lot of money that gets thrown to the bottom line. And so I think this was, probably an important investment for them to stop the bleeding, right? They probably had to reach into the balance sheet and make sure that their cancer care business was solid because they're going to need that to continue to get through this turnaround they're in the middle of.
Yeah, it's interesting. It's I don't have it fully formed in my head, but the business of running a health system is evolving, right? Like Mass General Brigham is I think clearly prioritizing oncology, investing in oncology. It says recruiting top oncologists to come join. At the same time, they're having 2 rounds of layoffs and cutting in other areas. And oncology and cardiac and orthopedic, there are lines of treatment, lines of business in the health system that are very profitable, and there are other ones that are not profitable. And that just is the way the reimbursement is set up now. And I think it's exemplified in Mass General as they're doing layoffs a month ago, and now they're investing $400 million in oncology.
Yep. So, look, we're just going to kind of continue to watch.
It's not good or bad. I mean, it just is. It just is that way.
No. Well, they're about to lose their cancer care partner.
Yeah,
so they have to do something.
Right.
They have to do something. This is a pretty big story, I think. DispatchHealth and Medically Home. So these are 2 of the big at-home hospital companies. They are merging, creating one of the nation's largest hospital at-home providers. I think we need to point out again, we talked about Amedisys earlier with Medalogix. Amedisys also acquired Contessa,
Yeah.
which was a hospital-at-home business that was founded here in Nashville. And I know that they were looking pretty closely at Medically Home for a while, but landed on Contessa as their asset. So these two merging, I mean, how many other players are there out there from a hospital-at-home that have any real scale? These two combined will have over 62,000 stays at homes per year. This is going to reduce the cost per patient by up to 30%. That's pretty significant. So this is now becoming a real company.
Yeah,
That's real scale.
Yeah, they have scale. I think the answer is there's a lot of very small home extensions with acute care facilities where they have in their catchment area they've done something small, but these two merging is going to be the dominant force. That's going to be huge. Definitely.
Yeah,
and I think it's a growing market. As you said, it's already decent size, but it's growing.
It's growing for sure. Pfizer has a new playbook for reviving sales, and it's starting to pay off. So this is not a vaccine conversation. This is about their drug Nurtec. So this is
migraine
medicine. Yep. And basically, they bought it. They kind of fumbled the bag with it. They didn't properly promote the drug, and now they are properly promoting the drug, and it's going to start generating some real revenue for them.
Yeah, and that is nice. I guess I'm happy for them, but that's not something I care about with Pfizer. Like, they're getting their marketing operations going, so they're not terrible, but they need to find some new science. I mean, just marketing better is not something that.
Well, I mean, they really are just a marketing company.
Well, yes, they used to acquire things out of biotech.
Yeah, they don't.
And then market.
Yeah.
And they haven't acquired that much recently. So it's just the cupboard's getting thin.
Well, I mean, they obviously they went all in on the
vaccine. Yeah, right.
We know what happened there, right, with the whole BioNTech thing. So here's a story about basically Lilly and Novo and what they've been able to successfully do with the FDA to get the compounders to stop all of the GLP-1s. And, all the telehealth companies are now coming out and saying exactly what we talked about, which is our customers are not going to be able to buy these products at the price differential. And so, they're going to try to make it they're going to try to find a loophole in making these as custom medications. But I think this is a losing battle for the hims and hers and other folks out there.
Yeah, it doesn't make sense. You can't violate intellectual property law because you don't like the pricing.
Yeah,
like that. I understand that it's expensive, but that has nothing to do with their right to sell it. So I just don't. I understand why they're doing it to keep it going maybe a month long, a little bit longer, but it's not.
I've told you I thought this was a really weird gamble in the first place. Mm-hmm. Like you had emergency, clearance to do this. You never had a clear long-term path to do this. And this is not analogous to the emergency clearance that we got for telehealth, right? This is different. There was a shortage.
Well, telehealth isn't owned by someone that doesn't have the IP to someone.
That's the point. Yeah. There's not like a loser in turning in expanding telehealth. Right. That's just more access. This is you're literally taking IP rights away.
Yeah.
So I think this is going to continue to deteriorate the stock value of hims and hers.
Yes.
All right, good story. Drug overdoses are on the decline in America. Year over year, they dropped 25%.
Yeah, which is great.
It's amazing.
I mean, we have a lot of overdoses still, but 25% less than last year. So it's a lot of deaths that we avoided.
It's amazing. I mean,
it hasn't gone down in 12 years, a long time.
So the 12 months ending in October of 24. I guess the reason why that's important to me is it was October of 23 when I was with my Aspen
Oh, yeah.
Health Innovators Fellows in Philadelphia.
That was maybe like the peak of.
Well, I guess that's kind of the point, right?
Yeah.
We're looking at this chart here, and I think when you look at it, it looks like Q3 of 2023.
Yeah. You were there right at the worst time.
Oh my God! It was so impactful to me, and we spent like a good amount.
We talked about
good amount of that show really talking about it, and they talk about in this article that it's sort of shifting geographically. So in the eastern states, it seems to be getting better, but in the western states, it's getting worse. And they also reference xylazine or trank, as it's called on the streets, saying that is actually decreasing the deaths because it's kind of it sort of I don't understand the science behind it, but it offsets the impact of the fentanyl in a way that may be decreasing the deaths. But as I told you, it creates these wounds that just looks like necrophilia. It's like
just open, terrible.
Disgusting. Yeah. Yes. So, it's unclear exactly what's driving this decrease, but obviously, 25% decrease in deaths that's material. That's a lot of lives that are not lost. So, let's hope this trend continues and that we have more clarity on why it's continuing to drop. But obviously, good news.
Yes,
good news. Oh, this is a fun story. So The Calling, a medical school journey review. So this is a documentary reality show about a group of students at New York's Albert Einstein College of Medicine, and it's kind of inspirational to see the next generation of doctors with all of the challenges that we face in the profession, the risk of burnout and all these other kind of things, and the bad stories about the decline in new doctors that are being matriculated into our industry. It's great to actually have some personality infused into this, and apparently, I mean, I haven't seen this. I look forward to seeing it. These young doctors are really, or soon to be doctors, are really inspiring.
Yeah, I haven't seen it, but I want to watch it. It's on PBS, and I think it's going to be good. And I need some happy stories.
Yes, especially about young people.
Yeah.
Tired of all the bad stories about young people. Yeah. Good stories about young people are great. Google rolls out medical records APIs and an AI co-scientist at their annual The Checkup event. They host this. Google Health hosts this every year. It was in Manhattan, and more and more APIs around FHIR. And more AI is kind of just where Google Health and the Google Cloud and Vertex are all going. Yeah,
and I think that's positive. I mean, more interconnectivity between health systems and physicians and even different health systems that aren't on the same platform is great. So I'm in favor of that.
Yep. CityMD inks a multi-year partnership with Notable to integrate AI into its urgent care clinics. So more and more AI getting rolled out into the clinical setting.
Right. Yeah, this is a pretty big platform. They bought the VillageMD assets. So they have a decent footprint.
Yep, decent footprint. All right. I thought this one was pretty interesting. An EMR company called Canvas Medical that we had never heard of, but we did a little research before we jumped on the show, launches Hyperscribe, which is an open source AI copilot. So when we first saw the headline, we thought maybe this was like a marketing scheme to like open source something for a little known EMR. But it turns out this is pretty fundamental to their company. They've been doing open source stuff here since back during the pandemic. They've been open sourcing different code that they've created. And it's a differentiated model to sort of build a developer-friendly ecosystem, as opposed to the typical closed-off ecosystem that EMRs are very much known for, where you can leverage the code and build all sorts of add-ons and create more value for customers of Canvas Medical, which seem to be physician practices.
Yeah, that's right. I don't have that much to add. I think it's a good space to bring this kind of flexible, open, you can build on if you want kind of solution to doctors.
Yeah. All right. This was a big week for NVIDIA. They had their big, what's it called? GMI or something?
He was calling it the Super Bowl of AI. Well, it has some other name.
Yeah, they've like their general meeting, they have a certain name for it. But in any event, apparently, like it was unbelievable the waiting list to like get into this thing. There were people. Did I send you the tweet from Robert Scoble?
No.
There was a line of people. It was like 6 or 7 blocks long, and the keynote was like going to start in like 10 minutes. I mean,
they couldn't get in.
There
was like security or whatever.
Just filing in. And Scoble was just talking about how he had, I mean, this is Robert Scoble. He's been going to these meetings for like
forever,
since like Jobs 1, right? And yeah, he said, I've never seen anything like this before. So apparently huge crowds for the NVIDIA keynote. And Jensen Huang, he had, for anyone who didn't see it, he had the little Star Wars droid, Blue, come out there.
Yeah.
And it was just, it was the Star Wars droid, I gotta say. Like, and he said, he was like, this is like legitimate. It was like learning in real time. He was talking to it. He was, it was.
Yeah.
We're getting there, man. We're getting there.
There's not, there hasn't been anyone since Steve Jobs with the combination of kind of really good technical products, but also the showmanship, the stage presence. There's a lot of great engineers that just can't do that.
And the focus, right? I mean, the difference between Jensen and Elon is the focus.
Right.
Elon is not focused.
No. He'll never be focused, I don't think.
No. And Jensen is massively focused.
Yes.
This is kind of the key difference between the two. So anyway, Jensen, he does a great job of sort of integrating NVIDIA's roadmap with where humanity must go.
Right.
And like making it kind of an imperative for NVIDIA to be successful for the future. For the future.
I have to win. Yeah.
So he said, AI computing needs to surge 100-fold,
Yeah.
It's amazing. It's amazing. Okay, so now a couple of counterpoints here from some opinion pieces. So there's one story that I completely disagree with. I think the headline's stupid. Wall Street Journal: Why most companies shouldn't have an AI strategy. Corporate leaders feel they have no choice or risk being left behind, but are they making a mistake? This expert believes so. And I mean, I don't know what.
Well, let me steelman this story.
Okay, go for it.
Because I think someone has to. So I think what he's trying to say is that the AI infrastructure and competitive landscape is still chaotic.
Yes.
Kind of like the internet in 1995. And if you created your internet strategy, then it would have been thrown out, because by 2000, everything, all the tools, all the vendors, all the competitive landscape had changed. And so it is not wise to spend too much time, money, resources in building a big corporate strategy at the enterprise level. I think that's the basic argument. I'm not sure that I would have made it myself and written it in the journal, but that's what he's saying.
Yeah, and I think the first principle here is that you can't afford to do it. You have more important things to do. And you can't afford to thrash around on it because it's not stable ground yet.
Mm-hmm.
And the next story, I think, is going to really articulate why I think that's wrong. Because I think you haven't priced in the other side of this. When that's your foundational reason, right?
Yeah,
You got to run your business on a quarterly to quarter basis, blah blah blah, all this other kind of stuff, right? Why, in the face of the Horizon Labs thing, which was a disaster, is Zuckerberg talking about the numbers he's talking about that he's committing to R&D and data centers when it comes to AI, right? Like, why is he doing that? Because you don't have a choice. This is literally an arms race. It's literally an arms race. And I would say, much like we started this show talking about how valuable the time we invest in this show has been. And by the way, we've had investors in our firm ask us, why are we spending our time on this?
Yeah.
Like looking for some straight line ROI out of it.
Yeah.
Right. And it's like, I don't even entertain that question anymore because I couldn't navigate this business world today if it wasn't for us doing this show.
Yeah, it's our job to have judgment on how the healthcare ecosystem is evolving and invest in teams that are building with the wind at their back and then help them.
Yes.
And so we have to know this.
I would say I can't afford to not do it.
Right.
And I think the same is true of AI strategy. Because if you're not actively working on it and working through it, you're not tracking its progress, which means you cannot properly project the implications for your business in the frame of Clayton Christensen's Innovator's Dilemma. Like you can't spot the weaknesses to your own value network if you're not messing with this thing, because it's changing so rapidly. And at some point, you don't even need to, you can track the trend by just messing with it over the course of a quarter, right? Just to sort of see the difference between 4.0 and 03.
Yeah.
And just be like, holy cow, like all my analysts, none of my analysts are as good as 03.
Right.
You know what I mean?
Yeah, I understand. And I agree with that perspective. And I think there's a lot of corporations that do not read Clayton Christensen's stuff, and they're sort of working on their existing business and just trying to get incremental innovations and not even that, just operate. They're focused on operations. And I don't agree with that, and that's probably why I'm in venture. But I think there are companies that are not trying to be innovative. And I think what you're saying is the overall world is going to change around them. Doesn't matter what business you're in.
Doesn't matter what business you're in. Doesn't matter what business you're in. Doesn't matter what business you're in. And to that point, a quite different article.
Same week, but from the New York Times.
Yeah. The headline of this article is "Powerful AI is Coming. We're Not Ready." The author of this piece, Kevin Roos, he's a technology columnist. He's based in San Francisco. And I always think it's good to sort of hear from someone in San Francisco, because San Francisco is a very different place, right? It's the heart of where all this stuff, at least in America, is emanating from. And they are every day talking about AGI in San Francisco. Yeah. Because they can see how close we're getting to it.
So let's define AGI just quickly. Okay. So AGI is, I think, I would define it as a system that is better at all domains of knowledge than humans.
Yes.
And it can learn faster than humans.
Well, AGI stands for Artificial General Intelligence. And general being the key word in those three words, which is different than specific intelligence. So we have these different LLMs today, and they're sort of tuned for different different specialties. I just talked about, the 4 series versus 03 versus the O series, right? O is a research series. 4 is a, prompt and fast engagement series, right? We've got Google coming out with very specific AI co-pilots for, decision support for clinicians, right? These are all specific. None of those are AGI. But we are getting closer in these general frontier models to something that has true general intelligence. And then you pair that with all of the voice technology. We just talked about, 2 weeks ago or a week ago, we did that demo.
Oh yeah.
With the voice AI,
great.
like the real time responses, and then you mirror that with all of the the deep fake stuff that they're able to do now, the video and image generation and voice generation, and then overlay all of that with robotics and the advancements in humanoid technology. that's a model that's smarter than us in everything, exists in the world of atoms, not just the world of bits, and can present in any way because it can generate presentation models in any way. We're not ready for that. We're not ready for that at all. So to me, it's not just AGI. It's the convergence of all of these technologies that are all happening at the same time.
Yes. And many of the frontier companies, there probably are 8 of them, 8 or 10.
That we know of.
Including 4 or 5 in China. They have multiple specific tools that are better than humans. And they are already connecting them together and experimenting on how they work together. It is not, they don't have to come up with some unknown invention that no one understands what it is. It's called scaling laws. They need to keep pouring a lot of compute, a lot of server time, and a lot of data, which they have both of, and they will get there. The only debate is, do they get there in 2026 or do they get there in 2035? And there will be...
Nobody thinks it's 2035 anymore.
Okay, so it's sometime between 2026 and before 2035.
It's in this decade.
In this decade.
Yeah, it's in this decade.
And then what are all humans going to do?
Dude, we don't know. I mean, like, this is why I'm like, the idea that you should not be working on a strategy is so for the head in the sand. It's like, what? For a long time, there was human labor that produced things. Yep.
And it was not very efficient, but that's all we had. And then with the steam engine and other stuff, we started having capital investment.
Sure.
And so then you had what we think of now, the traditional economy. We have labor and capital.
Yeah.
Those are the
steam engine, electricity.
Those are the 2 major inputs.
Yeah.
And they've been roughly equally valuable.
Yeah.
They swing back and forth 40, 60%. This, I think, is going to dramatically swing towards capital. Right? There's going to be 8 or 10 companies in the world that have this base of technology, and they don't need any people, or they need tens of people. And we're not ready for that. I don't know what that even means to society, but we're not ready.
We're not remotely ready for that. Yeah. What I love here is, the subtitle of this article, right? 3 arguments for taking progress towards artificial general intelligence, or AGI, more seriously, whether you're an optimist or a pessimist. That's I mean,
whether you think it's Terminator 2 and we're all going to die, or you think it's going to be wonderful Utopia. Abundance, either way, we're still not ready.
We're not ready. Not even remotely ready. The vast majority of people I talk to on a regular basis are certainly way more focused on the political situation. Mm-hmm. Certainly way more focused on the political situation, and then the economy. And then I would say, it's a toss-up between climate change and AI. I think a lot more
climate change does not matter. We're all going to be, there's going to be AI 40 years before climate change matters.
I'm just telling you.
Yeah. The timing of climate change is way beyond
the pace of so we talk a lot about when the rate of change exceeds the ability for a narrative to properly convey it. And that's what we're dealing with in AI.
Yes.
That's what we're dealing with in AI. The rate of change is way too fast. Thank God I've got you, and because look, I'm like doing stuff. You know what I mean? Like, I'm raising a fund, whatever. And so it's like, I can't, like, I don't have all that time to, every time I check in, I'm like, when I realize how far this stuff, you're playing with it more than I am. But if it wasn't for you and like Nick Holland, dude, I wouldn't even know how fast this is going. So,
yeah, and No, I mean, when maybe 2 years ago, there was a group of people saying we should be cautious. We should try to slow it down.
Yeah.
That does not exist anymore. There is no
Forget about that.
contingent of people
Forget
that are
about
trying
that.
to do that. It's like full gas all the
Forget about
time. We'll figure it out when we get there.
Yeah. So at Tunguz, who used to work at NVIDIA, that I follow him because he's like an ex-NVIDIA guy. He put this post out on X, and I thought it was a really good prompt. One of the top labs makes the announcement that they have achieved full AGI, an AI that's better than any human at any conceivable task. What will be your first reaction? What will you do? And it's just like, it's a good thought experiment. It's try to put yourself into that situation. You wake up, you open the paper, you open your phone, you turn on the TV, and the announcement is made, DeepSeek or OpenAI or X.AI, whoever has achieved full AGI. Like, how do you react to that?
There's a lot of ways to go with that prompt.
How do you react to that? All right, final story. You took my advice and you started reading AI Superpowers.
Yes, which is incredible.
Yes.
Really, I mean, I just started it last weekend, so I haven't finished it, but it's really good. And even though it's 6-7 years old, I mean, it's good today.
It's really
good
today.
right now.
I think it's
I
better
think if I had
today.
read it then, I wouldn't have believed it.
I think it's better today than it was then.
Right.
Yeah.
And so that entire thesis that China's super competitive, aggressive markets that we don't even understand. Like, what do you mean that you can just copy things and there's no protection? That has prepared them.
Yes.
And like,
yes.
what do you call it? The gladiators or something. Like, there's been such a fight over there that now they're battle hardened, and they are
in a way that we're not, because
we're
the
not.
regulatory stuff protects us here.
Yes. Right. Then I just have noticed, I think it is actually factually true too, that there's more China stories now. I think after the tariff thing, I think they started some PR, and after DeepSeek maybe, that like, hey, we have technology companies here too with all these positive stories. But
and dude, I told you when I was in Riyadh,
yeah.
it's something you never see it here, and so you just can't wrap your head around it. But when I was in King Fahd Financial District, I'm looking at big American companies having a building basically next to big Chinese companies, and that just, after I saw that, I can't unsee it, because I realized that is how the rest of the world,
that's how they view them.
views this stuff. Like, it's not like Google's up here and Tencent's down here. It's not that way at all. At all.
Yeah. And so Baidu 2 days ago reduced a new AI model called Ernie 4.5. It performs better on all the tests than OpenAI's most recent model, which is also 4.5. But it's half the cost of DeepSeek 1, which is their internal Chinese rival. DeepSeek was about a tenth the cost of OpenAI. So China is as good in performance, and they're competing on price very effectively. I was talking to a founder today who was saying that he is worried that Americans are sort of using these Chinese models and assuming the data will be safe. It's not going to be safe. They're using your data. OpenAI is using everyone's using data for training.
Well, that's not the same. We need to. You're talking about the app, not grabbing the open source code.
So that's different. It's been, well, at least DeepSeek has been put into a lot of different formats where it can be good. Yeah. But actually going to their site, it's not wise.
Going to the app.
Yeah.
I mean, look, like, Americans were ready to go toe to toe over losing TikTok. So I just feel like that's not even a story we need to run down, because Americans don't care.
Yes, that's right.
Americans don't care where their data goes.
Yeah.
They don't care who has it. They just want the next app.
Right.
They don't give a shit.
Yeah. Yeah. So China is, they're good. They're competing head to head and winning a lot of things. And so I'm choosing to see that as positive, because our companies have to get their act together.
But they're soft.
But they're soft.
I mean, that's what you realize when you read the book.
Yeah.
They're soft.
Yeah.
They're soft. All right, man. Amazing show, dude. That was an hour and 30 minutes.
Yeah,
That's
a little
because
bit long.
I ran us long in the intro, but great show. And once again, I feel ready for the next week.
Yeah.
I've got my information.
Yes.
Thanks, man. So you're back next week?
Yeah.
Okay.
Yeah, I'm here.
Yeah. Okay, great. All right. See you then.
All right.